The GAD-7 anxiety screener catches what subjective observation misses. Many addiction treatment patients arrive with elevated anxiety scores you never charted. In addiction treatment, anxiety is everywhere, and elevated scores are common across the patients walking through your door. The GAD-7, Generalized Anxiety Disorder 7, here's what it screens for, what its score can and cannot tell you, and how operators put it to work at intake. We cover the 7 items the GAD-7 screens, what its severity score can and cannot tell you, and how to use it across your intakes. The GAD-7, Generalized Anxiety Disorder 7, is a 7-question test patients fill out themselves to determine the severity of their anxiety. It is a short, 7-question self-report. Patients complete it themselves, which makes it fast to administer across a full intake caseload. The score reflects the severity of anxiety symptoms. It is a screener, not a label. What it tells you is how strong the signal is. Measuring behavioral health conditions is tricky. You are human. You have missed and misinterpreted things, and the field is moving to value-based care where outcomes must be tracked meticulously. The industry is shifting from fee-based to value-based care, where outcomes need to be tracked meticulously. Without a measure like the GAD-7, elevated anxiety in your patients stays invisible in the chart and untracked at outcome time. Behave Health includes 12 clinical measures built into its all-in-one EHR, with the GAD-7 among them, designed so the screener you need is already in the platform. 12 clinical measures are embedded in the app: GAD-7 for anxiety, PHQ-9 for depression, the BAM for substance use, and 9 more. Because the tools are cloud-based, patients can complete the GAD-7 on the device of their choice, designed to fit how intake actually happens. The GAD-7 screens 7 specific signals of anxiety. Here is what each item is reaching for, and what a high score should and should not do next. 3 things to understand: the 7 signals it screens, the limit on what it can diagnose, and how to use it at intake. First, the GAD-7 screens for nervousness, an inability to stop worrying, and excessive worry. These items reach for the core of anxious thinking: feeling nervous, being unable to stop worrying, and worrying too much. It also screens for restlessness, difficulty relaxing, easy irritation, and an overall sense of dread. The remaining items capture restlessness, difficulty relaxing, becoming easily irritated, and an overall sense of dread. Third, know the limit. The GAD-7 cannot diagnose generalized anxiety disorder. The GAD-7 can't diagnose generalized anxiety disorder. Treat the score as a signal, never as the final word. What it can do is help you determine whether to refer a patient for a clinical assessment of anxiety. Because anxiety is so common in this population, the practical move is to administer the GAD-7 in every intake, then act on the elevated scores. Many addiction treatment patients have elevated GAD-7 scores, so it is worthwhile to administer this measure for all of your intakes. When the score comes back elevated, use it to decide whether the patient should be referred for a clinical anxiety assessment. The GAD-7 is one of 12 clinical measures Behave Health has built into the app, covering anxiety, depression, substance use, trauma, and more. GAD-7 for anxiety, PHQ-9, and PHQ-15 for depression and physical symptoms, and the DAST-10 drug abuse screening test. The Major Depression Inventory, the Brief Addiction Monitor, Audit C, and the PCLC PTSD checklist. The ACE score, the Altman Self-Rating Mania Scale, the Addiction Severity Index, and the Panic Disorder Severity Scale. Behave Health embeds these clinical measures into one all-in-one EHR and CRM, designed so screening is part of the workflow rather than a separate step. The GAD-7 is embedded directly in the app, alongside 11 other measures, designed to support documenting and tracking conditions in one place. Because the tools are stored in the cloud, patients can complete measures on the device of their choice, designed to fit your intake flow. Stop letting anxiety go unmeasured at intake. Book a 20-minute demo of the GAD-7 and 11 built-in clinical measures at behavehealth.com. See the GAD-7 and the full set of built-in clinical measures at behavehealth.com.